Thank you, Haley. Hello, everyone. Welcome. Hola, bonsoir, buonasera. I'm Dr. Gina Friel. I am a pediatric nurse practitioner and director of the Global Nurses Working Group at Columbia University Mailman School of Public Health in the United States. I welcome you with great pleasure to session 3 of Nursing on the Front Lines of the Climate Crisis, Education for Action. The topic today is food and water security. In a moment, we will be hearing more on this from nursing expert Dr. Martha Fuller, with the common goal to improve our understanding of this topic so that we can increase our knowledge and skills to take better care of our health, the health of our patients who entrust us with their care, and the health of this planet that we all share. I encourage you to attend all 10 sessions in this series, either live or asynchronously, as the content of each session will build upon each other. Please refer to our website. Here you will find the course objectives, course schedule, slide decks for each recorded session, along with other very detailed information and session resources. Just a few housekeeping things on attendance. Individual attendance is automatically recorded during the live Zoom sessions and video recordings or asynchronous views. Please note, attendance will not be counted if you join with a colleague's link. The video recordings for each asynchronous attendance will be available following each session for asynchronous view through YouTube on the Alliance of Nurses for Healthy Environments platform. We will be offering continuing education for US-based participants. Continuing education, or CE, will be provided through the Alliance of Nurses for Healthy Environments. In order to receive CE, and one CE will be available per individual webinar, participants must attend the live webinar session or view the recording asynchronously and receive at least 80% on the post-session evaluation. Participants who attended the live webinar session on Zoom will be provided a password, which allows them to bypass the video viewing requirement, and it will come from the following website seen here on the slide, MSPH, etc. Please allow 2 to 3 days following each live session to receive this email. And don't forget to check your spam folder as well. Participants do not need to complete the CE process in order to receive a certificate of participation. Certificates of participation will be offered to participants who attend at least 7 out of 10 live Zoom sessions or view the recordings asynchronously and pass the course final exam with a score of 70% or higher. Again, please note, it is mandatory to join the Zoom classes, watch the video recordings, take the session post-tests and end-of-course survey utilizing the same email address. Session logistics. Each live session will be 60 minutes in length and held on Tuesdays from 12 to 1 p.m. Eastern Standard Time. At the end of each session, there will be a live question and answer section. Please note, questions for the presenters must be entered into the Q&A and not into the chat. So let's begin. It is my pleasure to introduce Dr. Martha Grant Fuller. Dr. Fuller is an associate professor of nursing at the University of San Diego, teaching in the nurse practitioner and doctor of nursing practice programs, where she is the lead faculty for the pediatric nurse practitioner tract. She is nationally certified pediatric nurse practitioner with over 30 years of experience in nursing, providing general pediatric care in a variety of settings, including neurodevelopmental follow-up of neonatal intensive care unit graduates, and coordinator of the high-risk infant follow-up program at UC San Diego Health, where she provided direct patient care, program management, and participated in multiple research projects. Dr. Fuller continues to practice clinically at Ray D. Children's Hospital Neonatal Neurodevelopmental Follow-Up Clinic. Her research interests include the impacts of socioeconomic disparities on child development, the outcomes of high-risk infants, the environment, and child health. She is active in several multi-site NIH-funded research studies exploring the outcomes of preterm infants, where she continues to perform comprehensive assessments of children enrolled in clinical trials. As a member of a multidisciplinary team addressing water quality and public health in Uganda, Dr. Fuller takes nurse practitioner students to Uganda for a global health experience. Dr. Fuller is an active member of the National Association of Pediatric Nurse Practitioners and is involved in other professional organizations supporting nursing research and pediatric healthcare. It is an honor and my pleasure to introduce and welcome Global Nursing Working Group member and core team member, Dr. Martha Fuller.
Hello, everyone. I'm delighted to be with you. I'm just going to get my screen ready to share. And I'm excited to see so many people and so many names in the chat. It's really quite exciting. We have quite a few objectives for this session today. I'm not going to read them because I think you're all able to read, but I do want to stress that as I do my best to meet all of these objectives, my real goal is that you're going to learn information that will allow you to go back to your own locations, whether it be a specific country or a specific region of the world, and utilize this information to make changes and help patients and families. I think you've seen this conceptual model before, and I want to reiterate the information that has been shared, that the people whose health is being harmed first and worst by the climate crisis are those who contributed the least to its causes and who are least able to protect themselves. As we think about water and food issues, I'll draw your attention to the ecological drivers. The interaction between global pollution, biodiversity loss, climate change are all significant, leading to problems with food production and access to fresh water. The mediating factors include those social determinants of health that we are all aware of. Having enough money to protect yourself, having strong government systems in place, having access to technology, and then, of course, culture and behavior. All of those factors lead to the health effects, with some people experiencing worse health effects and others experiencing fewer. As nurses, we often think about prevention. So when I think about food and water issues related to climate change, I think about primary prevention, our goal to stop increasing temperature changes. I think about secondary prevention, our goals to help develop resilience, and mitigate factors whenever possible. And finally, tertiary prevention. When there's been a disaster, when there's a famine, what do we do to help treat those who are the most severely impacted? Food security is defined as when all people at all times have physical, social, and economic access to sufficient, safe, and nutritious food to meet dietary needs for a productive and healthy life. As you can see in the image in yellow from the United Nations Sustainable Development Goals, we are not yet close to meeting this goal of food security. We know that we have made little to no progress reducing anemia worldwide, and multiple people face hunger. We already have a hunger crisis that we anticipate to worsen due to the adverse impacts of climate change. When I read that between 691 and 783 million people faced hunger in the year 2022, I'm overwhelmed. Those numbers are so large as to be incomprehensible. Undernourishment, in this instance being described as inadequate calories, is at 9.2% prevalence worldwide and 19.7% prevalence in Africa. Food insecurity worldwide, defined as having inadequate food or concerns about adequacy of food, affects almost a third of the global population. This map shows in darker colors, red and orange, the countries that have the highest percentage of the population that is undernourished. And this data was from 2021. This is a really wordy slide, and I apologize for that. I know it's better to have slides with more images, but this information seemed very important to me. We know that with climate change, the environmental factors that impact food production are going to vary from country to country and within countries from place to place. Heat stress will have some varying impacts. For some northern climes, they will have increased yield of crops, but others worldwide will have decreased amounts of crops. 25% of croplands currently have economic water scarcity. That doesn't mean there's no water necessarily, but it means that they're unable to purchase or get the water to the cropland to irrigate. Rising levels of carbon dioxide will lead to lowered content of important nutrients, including zinc, iron, protein, and B vitamins. This is particularly concerning if we think back to the UN Strategic Development Goals, which showed that we have not come close to improving the rates of iron deficiency anemia. We've all heard about the loss of pollinators. Fewer bees will lead to reduction in production of fruits, vegetables, and nuts. Higher temperatures are leading to increases in pests, which eat crops, and fungi and bacteria, which deteriorate the quality of foods. Ground level ozone causes decreased production of food. Soil degradation due to numerous factors can lead to crops that die or contaminating crops. Changes in fisheries. Temperature variability will impact production, and we're going to speak more about the impact of changes in water and temperature. And biodiversity losses, less resilience to environmental changes. We have many farms and many agricultural areas which, instead of growing multiple crops, grow only one crop because it's economically viable. However, if you have a huge field of one crop that is sensitive to heat stress or sensitive to a specific pest, you will end up losing your crop. An article from 2022 in the journal Nature Scientific Reports used extremely complex modeling of historical data, and they predict that for every 1 degree rise Celsius, severe food insecurity will increase by 1.4%. Every 1 degree rise Celsius will cause an increase in moderate to high food insecurity by up to 2.5%. The anticipated impacts will be worse in Africa and parts of Asia. Now, as I'm talking about all this negativity, I do want to remind us that there are things we can do. As we redouble our efforts to mitigate climate change and stabilize other human caused environmental changes, we can make a difference. Climate change has adverse impact on nutrition, causing both underweight or stunting and malnutrition when particularly children have inadequate calories and nutrients. However, climate change is also associated with overweight. And as we probably all know as nurses, patients who are overweight are not necessarily having adequate nutrition or nutrients. They have extra calories from eating poor nutrient, caloric dense foods such as junk food and fast food. Many places have grown to growing fewer types of food, leading to biodiversity loss. Climate change also leads to biodiversity loss because some crops are not able to thrive in increasing temperatures or changing amounts of water. The combination of climate change, less crop diversity, leads to crop damage and causes higher prices, less food, and more hunger. The Lancet report on the syndemic of obesity, undernutrition, and climate change provided 4 different models of the complex interactions between natural systems, humans, communities, and nutritional status. A syndemic is the presence of more than one pandemic simultaneously. And in this paper, they discuss the syndemic of both underweight, undernutrition, and obesity. And they provided a case study. Children living in an urban, low income section of London were overweight. The parents were working at jobs that did not guarantee hours or salary. The mother was well aware of how to provide healthy, nutritious food for her children, but had a major lack of time because, of course, without guaranteed hours or salary, they needed to work whenever they could. Healthy food in their neighborhood was more expensive, and the community made fast food or junk food much more available. I think many of us have seen this when you go to some poor communities and you go to a small market and there's no produce, but there are lots of bags of chips or crisps. I'll encourage you to look at the model labeled B, the global syndemic view, and you can see the interactions between natural systems, economics policies, so economics and the workplace, a job that doesn't provide guaranteed salary or hours, and the community, a community where fast food is present, all interacts to lead to undernutrition at the same time as obesity. So I would challenge you to think and share with each other in the chat. What can nurses do? Typically, as a nurse, I think I need to provide education. But in this instance, the mother is well aware of how to provide nutritious food or what should be consisting of true nutritious food. What other options do we have? And I'd like you to think of your own communities and share and learn from each other in the chat, since unfortunately there are too many of us to have a robust conversation. Climate change is a driver for disease, for decreased food production, leading to increased cost of food, and to decreases in food safety and quality. For example, decreases in nutritional content of some foods. This interacts with multiple factors, and you end up with more at risk of hunger, more with poor nutritional status, and increased risk of malnutrition. A child with a disease is more likely to be malnourished, and someone who's malnourished is more likely to have a disease. It's a very complex interaction between all of these. In addition to what we know will cause vulnerability and problems in low and middle income countries, places which have traditionally not contributed to the cause of climate change. Globally, even in high income countries, poor people, the elderly, and the children will be the most at risk from adverse nutrition due to climate change. So, what about water? The definition of water security is a bit complex. The capacity of a population to safeguard sustainable access to adequate quantities of acceptable quality water for sustaining livelihoods, human well being, and socioeconomic development, for ensuring protection against waterborne pollution and water related disasters, and for preserving ecosystems in a climate of peace and political stability. That sounds like utopia to me. Right now, safe drinking water for sanitation, hygiene, and drinking is out of reach for billions of people. And many people live in water stressed countries. And species that are dependent on wetlands have declined. If you look at the map of the world with blue, darker countries show the percentage of the population with access to safely managed drinking water. Unfortunately, data is missing from a fair number of countries throughout the world. The death rate from unsafe water sources is shown in the map with yellow. The darker the color, going from orange to rust color, shows the higher percentages or the higher estimated number of deaths attributed to unsafe drinking water. So people without access to safely managed drinking water are more likely to die from a variety of diseases and causes. This is particularly true for children. So the somewhat pixelated map, I apologize, that shows water stress is showing the percentage of the global population facing water stress. Water stress is defined as the ratio of water demand to the renewable supply, and it measures the competition over local resources. So, if a country or a region of a country is facing extreme water stress, which is shown in the darkest red, that means it's using 80% of its available supply. Globally, about half the population of the world is exposed to extreme water stress or to water stress for at least 1 month a year. And that number is expected to rise by 2050 to 60%. Obviously, water is necessary for food, whether it be for agriculture, for food preparation, but water is also an important driver of economic development. If you look at the image figure labeled figure 1, the linkages of water and food systems, you can see that water, whether used for drinking and hygiene, food preparation, or food production, all goes together to allow for improved stability, access, and availability of food security and nutrition. Water used for energy production and for other industrial purposes also goes to economic development, which drives food security and nutrition. It's an extremely complex interaction between water, water resources, health, and food. So, what do we expect with rising temperatures? That will depend on where you live. Many places will have significant drought, which will kill crops, leading to food insecurity. Other places may have increases in rainfall and increases in storms. And I know we'll be talking more about climate related disasters in a future session. What happens when there's too much water? Too much water damages water infrastructure. The recent flooding in the United States, in the state of North Carolina, in the mountains, damaged the water infrastructure for the city of Asheville, North Carolina. That's a city of 94,000 people. And they anticipate that it will be weeks before that city will have access to safe water because of damage to the water infrastructure. We've all heard about global sea level rise. Flooding at high tide has increased between 300 to 900% over 50 years. Of course, it depends on what part of the world you're in and where the high tide is. The question is, what does this mean for food and water? And what are the contributing factors to sea level change? One contributing factor is our use of groundwater. As we use groundwater, we end up the water that we take out and use, whether for drinking, for production of oil or gas, such as fracking, or for agriculture, the water eventually ends up back in the ocean, contributing to sea level rise. Groundwater could help mitigate the impacts of climate extremes on water availability. However, the ability for groundwater aquifers to recharge is being decreased by climate change and by excess use of groundwater. These images show the interaction between fresh water or fresh groundwater and saline water or salt water in the ocean. When we use groundwater, as noted previously, it returns to the ocean. And this causes sea level rise, which is particularly important in coastal areas. In addition to causing a rise in sea level, if you look at picture B, you can see a dotted line showing subsidence of the ground surface. So the ground sinks, which also contributes to sea level rise. As we have increasing sea level rises, if you look at pictures C and D, you can see an interaction between freshwater and saltwater. As you have lowering of the ground surface area through subsidence and increasing sea level rise, you have more salt water interfering with fresh water. Previously, when we talked about changes in the earth with ground being more saline, this could be one of the causes. The authors of this paper do suggest that there are things that we can do. Helping maintain a healthy ecosystem with forests and with wetland rehabilitation can be very important to prevent these problems. They also propose there should be plans for how to best use groundwater. And these plans may need to be globally and internationally organized because some groundwater sources are available to the more than one nation. As flooding and rising sea levels occur, there will be more pollutants in the marine ecosystem, causing toxins to build up in some of the seafood. Temperature change will also impact how seafood can grow, impacting seafood security. So there will be problems for human health, both from diseases from sea creatures that have toxins or other pollution, and also for people whose livelihoods depend on animal protein from the sea and seafood businesses. A study in Sri Lanka found that in that country, 50% of the animal protein consumed is from seafood and fish exports. And that's an important driver of the economy, which is at threat because of rising sea level. Using a very complex integrative assessment model, scientists try to determine what we can anticipate with the interaction of temperature changes, water insecurity, and food insecurity. The top map with the lighter colors shows 2020. The lower map with the darker colors shows 2050. They expect that by 2050, places with the darkest color red, 61.5% of the population will be impacted due to rising temperatures and climate change. Drought can be a concern with climate change. This particular map was released prior to the recent hurricanes in the United States. But even so, you can see that a significant portion of the continental United States, as well as Hawaii, are suffering from abnormally dry seasons or drought. So, what does drought mean in a country like the United States? I assumed erroneously that our water system was secure and that I should have no concerns about it. However, the water system in the United States is fragmented with multiple community water system providers. Some are public, others are private and for profit, and many are quite small, serving less than 3,300 people. This is particularly true in older areas, more remote locations, rural communities, and places where poor people and communities of color live. So at times of drought, there's a political context. There are natural hazards that occur. And then there's policies and management that impact the flow of water to community water systems. Community water systems are also impacted by even more specific local policies and management. And this leads to household water insecurity or security and the behaviors of households. Larger systems are better able to respond in times of drought. whereas small systems are more severely impacted. We have one example. In the state of Arizona in the United States, there's a community called Rio Verde, which is located outside the large metropolitan area of Phoenix and Scottsdale. Developers built this community and took advantage of legal loopholes to build a community without ensuring long term water resources. For some period of time, water was brought to this community by a relationship with the neighboring city of Scottsdale. However, that was a temporary situation and that water has been discontinued. This community does not have access to an aquifer or a water supply, and currently residents in the community must purchase their own water individually. So, an example of things we can expect with increased rainfall, excuse me, and climate change can be found in Scandinavia. As we're probably all aware, with water, there's more rain, there's more runoff. And if the runoff is in areas where animals have been grazing or where people who have no sanitation, as is true in some parts of the world, are, the water runoff picks up more coliform bacteria and changes the water quality. Even in a country like Norway, they can anticipate needing to make changes in their current water treatment practices to mitigate the impacts of climate change. This is a case study of community water insecurity in southwestern Nigeria. So, again, I encourage you to chat with each other and share with each other. What role can nurses play in communities that have water insecurity? And what do you think the impact of water scarcity will be? This community faced water insecurity in both rainy and dry seasons. In the dry season, almost half traveled over 30 minutes round trip for water, compared with none traveling over 30 minutes during the wet season. That's a significant amount of the day traveling to go pick up water. And I know from a research project I'm doing with colleagues in rural Uganda and southwestern Uganda, there were some families who traveled an hour or more each day for water. In the wet season, people were generally satisfied with the quality of their water. However, far less qualified or far less satisfied in the dry season. So, what happened in the dry season and what happened to the families with the greatest water insecurity? They had significantly higher burden of diarrheal disease in children when they had higher water insecurity. Worldwide, waterborne diarrheal disease is the third leading cause of death in children under 5. We know that millions of individuals lack access to improved drinking water, and even more lack improved sanitation. Cholera is an acute diarrheal disease that can cause between 21,000 and 143,000 deaths per year. And the cause is ingestion of food, or more likely water, contaminated with Vibrio cholerae. So, how does climate change and drought impact cholera? In times of drought, we have changes in human behavior. Population may have to move or be displaced. Some people move into urban areas where they create informal settlements that don't have access to sanitation or water. there's a lack of infrastructure. In rural communities, there can be crop failure and livestock loss, leading both to moving to an urban area or to famine and insecurity. There's poor health care and a lack of sanitation, hygiene, and water. And many countries have poor water management. There's some that have new and improved water sources, and others that don't, and some risky behaviors. Drought causes environmental changes, decreased or more variable precipitation amounts, which can change the surface water available. As the temperature rises, there's more evaporation of water, changes in pH and salinity, changes in aquatic species, and more pathogens. All of this leads to more pathogen exposure, and for those who have malnutrition, decreased immunity and can contribute to cholera outbreaks. The ecological planetary health model, which is shown here with concentric circles starting at the individual and expanding to the Earth, is the model that we used for developing this series of lectures. Strategies that we use to address climate change include adaptation, mitigation, building resilience. And those occur both at individual and family levels, community levels, regional levels, internationally, and through planet Earth. And all are impacted by the cultural, political, social, and economic environment in which we live. This model does provide us with the ability to see action that we can do as nurses. For water, we need to think about both adaptation and conservations. As individuals, we can move toward ways to use water that is more efficient. For example, drip irrigation for the garden. We can decrease our personal water use. The favorite thing to tell people in the state of California, in the US where I live, where we frequently have drought, is to turn off the tap while brushing your teeth. Technology exists, low flow toilets, making sure that when you're washing laundry in a machine that you do a full load or use a small size setting. And then of course addressing household leaks. In a more global way or more national way, we need to work to promote and protect wetlands. There are moves throughout the world to rebuild mangrove forests which had been destroyed. Mangroves provide two benefits. They can prevent coastal flooding and add to resilience in the anticipation of rising sea levels. They also are massive carbon sinks. They're able to capture and store carbon. So, what can we do in healthcare? I was trying to find evidence that would research that would help give us guidance. I found that a lot of research is being done in ways to decrease the water use for hemodialysis. And of course, as we're working in our institutions, we can be aware of problems like leaky taps and other things that could be changed to reduce the presence of the overuse of water. So if we think about the concentric circles, we then move to national issues. So risks impacting water security include risks that are environmental, such as earthquakes, geogenic contaminants. So some water supplies are contaminated with a variety of toxins, including arsenic, depending on where you are obtaining your water, and climate change related problems. Extreme rainfall events, as noted previously, damage water system infrastructure. Drought causes lower river flows, Sea level rise is impairing the groundwater quality. And then there are the anthropogenic risks, wars, conflict, development upstream, exploitation of groundwater, which is occurring regularly, leading to a declining water table. And since groundwater could be a place that we can have resilience in the event of as climate change worsens, this is a significant problem for the future. All of these factors work together to cause insufficient water supply. But there are some adaptive strategies that can be done. Coming up with ways to augment water supplies, including things like desalination. We can work to reduce water demands and work to improve water efficiency and management. Now, looking in the chat as you all joined, I know that we come from all over the world and we all have different abilities to advocate with our government, but many of us can make local changes. We can work to improve policy of water management, and we can think about ways that we can add to reducing water demands. So, what can we do in terms of food? As nurses, we are some of the most important healthcare providers for providing nutrition education. When we're speaking to a global audience, some of this sounds a little ridiculous because I know that in many parts of the world, meat is a rare treat and not the main part of the diet. However, for those of us in some high income countries, we know that the typical diet of meat and potatoes has a very high nutritional, a high impact on the environment. Research shows that eating less meat and that the Mediterranean diet and vegan diet have a lower environmental impact. I particularly liked this image of the Mediterranean diet because at the bottom it shows logos from multiple countries and multiple parts of the world. The only way that we will be able to successfully address climate change is by working together worldwide. Another suggestion for how to address food insecurity is to diversify our food sources. Chef Marcus Samuelsson wrote an editorial that appeared in the New York Times, and he proposed the use of various African grains. Teff, which is the staple food of Ethiopia, is able to survive in both wet and dry conditions. It is gluten-free, high protein, and as you can see if you look at the bottom, it has higher iron than corn or maize, wheat or rice. And yet at present, 66% of the food consumed in the world comes from only three grains: rice, corn or maize, and wheat. It's time for us as nurses to help patients and families consider alternative sources of foods that can provide more nutrition and have a lower environmental impact. I believe I already said that teff is able to survive in times of drought and times of wet or higher rain content, giving it remarkable flexibility. There are other grains and other things that we should look at as ways to change the diversity of our diet. I wanted to leave you with a few resources. There are multiple resources you can use to get information. And these are a few they are in the slides. These are places where you can get a lot of information that you can take home to your own locations and use as you're trying to address food and water security and illnesses. Thank you very much for your attention. I appreciate it. And I think I turn it over now for questions.
Thank you so much, Martha. That was a wonderful presentation. And I also wanted to let you know that there are a very viable chat with a lot of the participants who offered many suggestions, and they have been really great suggestions, and to your questions posed about things that we can do for food insecurity. And in addition to that, there are many questions in the chat, and so we will try to get through as many as we possibly can in the remaining 9 minutes of our course today. It goes by so quickly. There is one question here. Given the interconnected issues presented, how can we prioritize actions to address climate change while simultaneously ensuring food security and improving nutritional outcomes for vulnerable populations?
That's an excellent question. I think that I see us doing multiple prongs, continuing our efforts to address and prevent worsening climate change, providing additional resources, and also helping communities develop resilience and the ability to mitigate them. As I did the research for this talk, it seems that if we don't focus on water first, we will lose the ability to address the problems related to food. In fact, one article I read was from a nutrition perspective, and they said, as nutritionists or dietitians, we've always talked about food and we've ignored water. And as climate change is approaching, they're suggesting moving toward putting more and more emphasis on how you address water concerns and water issues. So, in my mind, if I had to, I don't want to prioritize because I am heartbroken with all of the images that we see in the world of people starving. But I think that we need to think about how do we address the interconnectedness. I also think we need to look at the interconnectedness of anthropomorphic challenges. So climates, I'm sorry, conflicts, as we are seeing in Sudan, there's horrors happening related, and they're related to man. They're related to human intervention. So I don't know if I answered the question, but
Thank you, Martha. All right, there is another question here. Can mothers who face underweight or overweight be given education on the locally available but nutritious and cheap ingredients so that they can use them in food preparation?
I think that's an excellent suggestion. I know that here in the United States, there is one program where the pediatric office felt that it was so important that children be able to have access to fresh produce that they built their office above a market. They built a grocery store underneath them, a market underneath them. And at every visit, the family's given a prescription to go downstairs and um, purchase that the prescription covered the cost of food for them. Now that's clearly something that's out of the reach of most of us, just coming up with the funding for that. But that was a very out of the box way to address a crisis in a community without access to fresh produce. I think that knowing what's available in your community and knowing what is important for a community is one way to help. It's also really hard. I'm a mother and a grandmother, and we want our children to be happy. They love junk food. They love nothing better than if they get ice cream cone or a treat. So we have to help parents know that there are other ways to help their children rather than just giving them high calorie, nutrient poor foods.
Thank you. I think we have time for one more question. In the United States, we cannot convince our elected officials to agree that climate change is happening. There are many of us aware and working to change that mindset. A heartfelt apology to the rest of the world that will continue to suffer our country's arrogance. How can we as nurses continue to work to change the American mindset in the context of water and food-related illness?
I think that number one, by being here, by taking part in this series, Nursing on the Front Lines, it really says it all. The title says, we're there, we're on the front, and we can make a difference. I agree. I am ashamed when I travel to Uganda every year to think about the things that people are suffering related to climate change that they did not cause, that we caused, our nation has caused. Um, would hope that we don't give up. I think that one of the most convincing arguments I heard was don't give up hope, keep trying. And if you think one person can't make a difference, think about going to bed at night with a mosquito in the room. So that one mosquito can keep you awake all night. So we need to all be that one mosquito. And as a group, as we make more and more comments and we become more and more politically active, I believe that we can make a difference. If I didn't, I wouldn't be here because I don't need to be depressed thinking about the horrors of climate change.
Thank you, Martha. We may have time for one final question. How does using groundwater resources impact water stress of a country? How do they relate?
So we all have varying levels of groundwater resources in our countries, depending on where you are, depending on the geology of your country. In the United States, for example, much groundwater has been used in the state of California, a lot of groundwater has been using for crops that should not be growing here because they require too much water. So they suck the groundwater out, and then that groundwater is no longer available for drinking. It's been going to, not that agriculture is bad, but it's going to crops that perhaps we don't need. So we have fields and fields of almond trees, which require a lot of water. So as you use the groundwater, it does two things. One, you lose the availability to save it for the future because it's not being replenished as it should be. It also takes eons to replenish a groundwater aquifer. The water also, once it gets out of the ground, it gets into the world, it then goes into the ocean and adds to rising sea levels. And also rising sea levels then lead to more salinization of our fresh water and to subsidence of the ground. So we actually are losing some of the ground by the sea. So it's very difficult how a country can manage it. I think one of the other places that groundwater has been used a lot, at least in the United States, has been in fracking. And so there's a lot of politics involved with this because some of these things lead to economic development, which is, of course, important for people's livelihoods. On the other hand, when we suck all the groundwater out, we no longer have it available as we have a time of drought, and the groundwater is going into the ocean and adding to rising sea levels. So I hope that explains the groundwater cycles.
Thank you, Martha. I wish we had more time to further ask the rest of our questions, but I wanted to thank you and thank everyone for joining in today from around the world. Immense gratitude to you, Dr. Fuller, for sharing your tremendous insight on food and water security with us today. Please join us again next week for session 4 in this series, Nursing on the Front Lines of the Climate Crisis, Education for Action. The topic will be extreme weather with Dr. Barbara Sattler. It will certainly be a timely topic for many of our friends and colleagues in Florida and North Carolina, Puerto Rico, Haiti, the Caribbean islands, and all of the areas across the world that have been currently experiencing the effects of these events. We are here for education, for action. This is what joins us together. Take care, everyone. Thank you for coming. Goodbye. Adios. Au revoir. Arrivederci. Ciao, ciao.